Hi guys, today we'll be doing mock test 7 questions. I'll be doing one sub question of it. So let's talk about trauma. An 18-year-old soccer player presented at your clinic after an incident. What was the incident? That during his soccer practice, which led to chipping in tooth number 11. So this is almost a similar picture that was given in the exam. You can expect a little more chipping here and there if they ask the same question. If they ask the different question, focus on the picture and what is being asked, okay? No visible sign of exposed dentine is present. So that the question also mentions. No soft tissue lacerations are present, which means that the question is telling you that apparently you have done the clinical examination and there is no soft tissue lacerations are there and there is no visible dentine is present. So what is your management and upstream approach in this case? See, let's talk about some common ground rules that we have when we start seeing a patient on a chair. Now, imagine, forget this question right now. I'm giving you a scenario to imagine so that you are able to solve any question that is asked, any similar question that is asked, be it any scenario. So, example, a patient walks in and says, Doctor, I just had a fall and I kind of chipped my tooth. So, what is the first thing that you would do is? The first thing is you're going to ask the patient, are you all right? Do you have any neck injuries? Do you feel dizzy or unconscious or something like that? Did you feel like that? Did you vomit something? Everything is a negative answer. So then you'll start focusing on the area of interest, which is his tooth. Before that, you have to make sure that the patient is all right. Okay. So there will be some ADC questions which will give you a big history, and then the question would be, what is the first thing that you would ask? And then the option would be to ask the patient if he feels his neck movement is okay or if he's fine. That should be your first answer. Okay. That is the hierarchy. And this is how you also approach the patient in a clinical setting. So that matches, right? So if you want to remember all these things, take a pen and paper and just start writing it down. In any case of trauma, the first thing of priority would always be to check if the patient is overall fine. Because if he's not, even if that case is of an avulsion, you will refer the patient to the hospital so that the patient is all right. The life of the patient is more important than that one tooth. Understand? So after you have found that the patient is fine, the next step, what happens is you will ask the patient to sit on the chair. Now, once the patient is sitting, you will be wearing gloves, okay? And the first thing that you would do is to check where the trauma has happened. And with the hard tissue, that is with the tooth, you will also check the soft tissues because you want to make sure that no injury is present, okay? You also will be checking why no injuries are present because, see, suppose there is a laceration in the inner surface of the lip and you fail to notice that. Now you don't have a record of it because you didn't observe, you didn't take pictures of it. And now suppose you start a treatment and you finish with it, and later on you accidentally observe that there is a laceration. You would be confused. Did you cause it, or was it there from beforehand? You understand? So also to save yourself, you have to examine everything properly and make a record of it. Even in my clinic, if any patient comes with a pre-existing injury, I always take the intraoral picture and keep it in my records because you don't want the patient to ever point a finger at you. Doctor, did you cause it? Because even he may not be aware that there is some injury going on inside. And if he accidentally observes and says, after my dental appointment, this was caused, so then you have a proof. No, it was there beforehand. You understand? So hence you would always see any soft tissue injuries there and you would make a record of it once you have ruled out any soft tissue injuries. Now, since your fingers are already in the patient's mouth, the next logical step that is you will touch the tooth and see if it's wobbly or not. You understand? So the first step is patient well-being. Second step is clinical examination with the mouth mirror and to see any soft tissue injuries. The third step is you would palpate and you would percuss that tooth because your fingers are still in the patient's mouth and you are not carrying anything else from outside. Once you have done the mobility, then if you would like, you would do the pulp vitality test. Pulp vitality test would involve you to take endo eyes or any other electrical pulp testing that you want to do. Once you are done with that, then the last step would come of a radiograph. because now you are done with the clinical examination, you are dictating the notes to your assistant or you're making a mental note of it. And then now you would, because see, even for a radiograph, you cannot just tell the patient, okay, open your mouth, hold this film. You have to take consent that you are taking a radiograph, and if the patient consents, then only you will proceed with it. So this is the hierarchy you follow to save time and in smoothness of the procedure that you would be doing. You will never start with a scenario that the patient came and says, doctor, I chipped my tooth, and you will be like, okay, sit, let me take an x-ray first. No, this is not how you go. It's a very haphazard way of examination. You understanding my point? So now that you know the hierarchy, excuse me, I'm about to sneeze. Okay, it didn't come. So yeah. So once you know the hierarchy, which is patient well-being, followed by clinical examination, followed by palpation of tooth, followed by vitality testing of the tooth, and lastly the radiograph. Then once all this is done, which is the exact steps of information gathering, when you will be appearing for your ADC Part 2 exam, you will understand that when there is a station of information gathering, these five things come into picture in that entire station, and you have to go sequence wise. You cannot be haphazard. So in a way, after giving Part 2 exam, now when I look back on the Part 1 exam, it's just an extension of it. So, whatever questions, the scenario based questions that the part 1 exam is asking, they are almost similar, which are carried into part 2. So, the way they are asking question also stays similar. There is nothing much difference. So, actually, it's more easier for you to solve if the part 2 exam, if you properly understand the part 1 exam nicely. Understandable? So, now let's go back to this question. Now, having this basic information in our mind, and this will also help in your clinical practice. So let's read the question again. An 18-year-old player presented. He had a chipped tooth, and the question mentions there is no soft tissue lacerations and no visible sign of exposed dentin. So, what is your management and upstream approach in this case? So, what the question is asking now, how will you manage after having so much information? What is the first question? Tooth fragment is missing. Tooth is tender to percussion. What do you have to check now? So you remember our hierarchy, I said you're going to percuss and palpate. So percussion they have already given. So what is the next step? You have to palpate. So you have to check the tooth mobility. If this question would have mentioned there is no mobility and the tooth is tender to percussion, now what you have to check, then I would have gone with the vitality. Okay. And if the question would have mentioned you are done with the vitality and the pulpal testing and the percussion testing and the palpableness of the tooth, etc., etc., then I would have gone with the radiographical examination. Understood? So here, because they have just mentioned percussion, my next step would be mobility. So I'm going to choose my answer as mobility. This is the answer. I've opened this mock test of a student who has solved and they have marked the wrong answer. So don't go on this. This is me opening the response of one of the candidates. So listen to my explanation and understand. And when you're going to solve this mock from fresh, you will not have such markings out here. You will just have plain question and the options, and you will have to mark. And once you receive the feedback, this is how you would receive the feedback with the explanation. Next, the tooth is sensitive to percussion and not mobile. Now you see this question? It says it's not mobile. That means you have done that clinical testing. Which radiograph are you going to take? See, the hierarchy that I mentioned exactly matches with this question and the way it's asked in the scenario-based question. After percussion, mobility, now the question is asking now which radiograph are you going to take? So even the question is following the hierarchy that I have just explained it to you. So it is periapical. I'm not going to take a bite wing because bite wing I will take for caries and for posteriors. For anterior also you can take, but now since I know which tooth has the problem, I will directly go with PA. Occlusal maxillary is not exactly a wrong answer, but it would be my secondary choice of radiograph. I wouldn't just directly jump onto the occlusal maxillary. So periapical is my first choice. Now, no radiographic abnormality was seen on the radiograph. Okay. A coronal fracture involving enamel only, treated with composite filling. You advised him to wear mouthguard during the practice as well. As a dental advocate, how do you create awareness within athletes about the mouth guard? So basically, the question is saying there was no radiographic abnormality. There was a small coronal fracture, which you easily treated with composite filling. Now, since he is a soccer player, remember the first main question? He sustained the injury because he was a soccer player. So, how to avoid future injuries? Because you are managing the patient also, you're not just treating him for the fracture. So, you want to give him an advice as to how to avoid such kinds of injuries in future. So you tell him that you have to wear mouth guards. Now, as a dental advocate, meaning as a person who wants to minimize the injury in the society, how would you create awareness within athletes? Now, this is the keyword. How do you create awareness? Means what would be your communication channel? How would you plan to do that? When you say awareness, it means more than one person, like a mass of people. How would you create the awareness? And in which mass of people? The general public? No, it's within the athletes. So you have filtered out the population. So even before I jump on to seeing the options, immediately in my mind, I should have these options. Where can I find athletes and how would I go and give them the information in the most effective manner? Should I take emails of the sports person and email them? But that is so difficult to gather. Or should I go to a playground and catch all the athletes and distribute pamphlets? Or should I catch the person who teaches them or coaches them? Or I should just plain take, permission from the schools or the colleges, and wherever they have the coaches and the athletes together, I would go and give a presentation. What do you think should be the more effective one? So once you have this similar options in mind, now you start reading the options, which will help you a lot. So, which would be the most effective way in which way you can create awareness within the athletes about mouth guards? So, first option, educate the coaches about benefits of using mouth guard. Fair enough. You can educate the coach passes on this to the athletes. Fair enough. Participate in the official club meeting and create awareness about cost versus benefits of mouth guards. Now, this option I would give more priority because if I'm myself there, I can give more info, the cost part of it, the benefit part of it. See, I can educate the coaches, but I can give them layman information, right? The exact technical information presented in the layman manner. And if any questions the audience asks, I'm the best person to give because I know everything about the mouth guards being a dentist. So if I get a chance to participate and directly give out this information in front of the coaches and the athletes, that would be the best option. Third option is give discount on mouth guards. No, this is not creating awareness. This is marketing. Issue free mouth guards for players. Now, this is also good, but you're not exactly creating an awareness. You might get players to get mouth guards, but they wouldn't understand why they are supposed to do it, why they are supposed to wear it, how mouth guard would be more effective, how it should be worn, why it should be worn, etc. So the awareness portion is not coming in the option C and D. A and B, if I'm confused, then seeing the B option, I'm more likely to go with it. Now, how should you educate the patient? Now, this question should have been how you should educate the patient about mouth guards, but they have just given this question. So, anyways, do not store your mouth guard in direct sunlight. Okay. Rinse it in cool water only after wearing and store it in water. Mouth guard doesn't need to be stored in water all the time. You can just rinse it and you can put it in a box. So it's not mandatory to store in water. Write the owner's name on the mouthguard case only. Okay. Rinse it in warm water only after wearing and store it in water. Again, storing in water is not mandatory. So amongst all these options, I would go with do not store your mouthguard in direct sunlight because it starts to warp. See, most of the mouth guards are of plastic material, the bilaminar or silicone types. You don't want them to warp because of the heat. And Australian sun, I don't know how it is because when I went to Australia, it was 5 degrees chilly. Assuming the sun is really hot or whatever it is, because I think there's no ozone layer out there also, and people tend to get a lot of skin problems and skin cancers, so the sun must be pretty strong. So, anyways, even if it wasn't, you want to store it in direct sunlight and result in warping of the appliance. So, I would go with option A. Not that I'm happy with any of the options, but amongst all this, I would go with option A. The mouth guard will prevent. Very important question. Direct injury, TMJ injury, indirect injury, direct, indirect, and TMJ injury. See, when I say direct injury, of course, that's correct. You're wearing a mouth guard, somebody tries to punch you on the face. Of course, it's going to prevent direct injury. What is indirect injury? Indirect injury is, see, you are wearing a mouth guard, and forget mouth guard. What is indirect injury? Say you fell on the floor, hitting your chin. So the first point of contact was the chin. That was direct injury. But your mouth also closed very forcefully, which resulted in a very stronger contact between your posterior teeth, resulting in fracture of one of your posterior molars. The molar was not in the direct line of contact, but still it fractured. Now that is called as an indirect injury. So if you're wearing a mouth guard, of course it separates both the teeth, the upper and the lower jaw, because of its design. And so when you have a fall, of course, it will prevent the direct injury. But because the teeth are not coming into contact with each other, it kind of prevents indirect injury also. Coming to TMJ injury, if somebody punches you directly on your TMJ joint, and even if you're wearing a mouth guard, it cannot prevent a TMJ injury. So it cannot prevent a TMJ direct injury. It can help prevent indirect TM injury. But when I just say TMJ injury, I have to take the direct and the indirect components also. So my answer would be direct and indirect injury. It's going to prevent. It cannot prevent a TMJ injury. So that was about the SBQ1 of this mock 7. I hope it was clear and solves a lot of your doubts regarding the hierarchy of examination and helps you with the other questions. Uh, we have currently 18 mocks now, like around 1,260 questions prepared with a lot of hard work. And we have discussions about them. And you can always personally WhatsApp me regarding any doubts. If you are one of my enrolled candidates, you know about it by now. And best of luck for your exam. Thank you.